Well, swine flu is entirely avoidable. Vaccination will mean that you won't get swine flu. It's really important that care workers have this vaccination.
The swine flu virus is a new one, which means that really all of us are susceptible to acquiring the infection.
Well, we know that swine flu can happen very quickly, and as we go into people's homes, into hospitals, it can have a major impact on how we go about delivering and assessing people for services. So it's really important that frontline workers have the vaccine, because it can protect not only themselves but also the people that they're working with in the community.
There are several million social care staff in the country providing services to vulnerable adults and to children. When I say vulnerable adults, that's older people, people with physical disabilities or learning disabilities, people with mental health problems, and also children's social care workers, including foster carers, residential care staff. It's really important that as many as possible are vaccinated to ensure we can continue to provide services and that they protect themselves and therefore don't infect others.
I think it's really important, particularly for family carers, to have it, because we rely so much on the care they provide to people who need it. Without them, the whole thing would collapse. If in any numbers they were not available, our services would be completely overstretched, because they provide so much of the care that people need in the community.
Swine flu can kill. It can be a very severe illness that takes weeks to get better. They can be in intensive care with multiple complications, and it can be touch and go, life and death situation for weeks.
It's very dangerous. Some of the patients that we see are presented with absolutely no symptoms at all. Others do present with symptoms. They come into critical care and they deteriorate very, very quickly.
It's a safe vaccination that can keep us working. We should have that immunisation.
I'm having the swine flu jab because I work in Birmingham City schools. I also work for social services and for young people, and it's very important that I have that jab.
I'm having the swine flu injection, first of all to protect myself, but also to protect all the older people. I'm a volunteer to look after them.
I had a swine flu injection because I work with the vulnerable.
I'm having the flu injection because I'm a diabetic, and I need the flu injection to help me because I work with elderly people.
I've had the injection myself because I'm asthmatic, and also to protect the elderly vulnerable service users who I care for and my family.
Because I do work with elderly mentally ill, obviously they're a priority with me, and this is why I've had my vaccine.
Flu. Protect yourself and others.